Consumer-driven healthcare defined contribution plans. The problem we have with our healthcare system is not the cost of any one particular service or surgery. It's not the quality, certainly. The problem that we have with our healthcare system right now is that our health insurance premiums are just too high. The premiums have doubled over the last 7 years, and it's really making people not be able to afford the proper health insurance. We believe there are two main problems with the system that are help creating these high premiums. The first one is the way we receive our insurance, the fact that it is tied to the employer. And second, it's the plan design of our insurance, co-pays, co-insurance, and deductibles. So let's talk about the first one here, the way we receive our health insurance. Small group insurance, by definition, is actually an oxymoron. You can't have small group insurance because rule number one of insurance is the law of large numbers. You've got to have enough people to spread the risk out so that you don't have huge premium increases to make up for the claims of any one or two people who get sick. And so the larger the group, the more the insurance works, the more level the premiums stay. If you have a group with only 10 members and one of them has a heart attack and one has a diagnosis of cancer, the rates of the rest of the group there, that all 10 of them are going to have to pay so much more in premium to make up for the claims, as well as the administration costs of the insurance carrier and their profit. So small group insurance just doesn't work. One of the other reasons small group insurance doesn't work is because of the federal and state mandates that are applied, because the employer is directly paying some of the premiums. In Florida, there are over 53 federal and state mandates that add anywhere from 40 to 60% to the premium. These federal and state mandates are things like maternity coverage. Whether you're a single guy or you've had a hysterectomy and can't physically have a baby, you have to have maternity coverage. Charging the same for a 20-year-old as you are a 60-year-old. So they don't look at who are we insuring, what's the risk, and charge the appropriate premiums. The federal and state mandates have tried to make everything equal for everybody, make it fair, and it's just increased the premiums by, like I said, 40%. And the third problem with small group insurance is portability. The fact that the employer owns the policy, not the employee. Our current employer-sponsored plan is actually the greatest threat to most employees' financial future. The employer-sponsored health insurance is the #1 cause of personal bankruptcy in the U.S. because of lack of portability. 1.1 million families last year had to file bankruptcy, but 75% of them actually had insurance at the onset of the illness or accident. But it was employer-sponsored health insurance. So when they got too sick or too injured to come back to work, because they didn't own the policy, the employer did, they lost their insurance, and at the time they needed it the most, they've lost their job, now they've lost their insurance, and they had to file for personal bankruptcy. So what we have is a solution. A third option is now available. The defined contribution platform actually allows an employer to give a fixed dollar contribution, tax-free, and employees to make contributions on a pre-tax basis through the Section 125 plan or through an HRA. The employer can contribute through an HRA. And then the employee can make elections. They can choose group products if there's a medical plan available or indemnity, mini-med plan. They can apply their allowance toward that. Dental, vision, supplemental coverage, as well as individual products, these personal health policies that the employee would own. They've got HSA plan designs, which we'll talk about in a minute, traditional copay plans, and of course the guaranteed issue plans that are coming in the near future. Employees can also apply dollars toward spending accounts. They can open a health savings account or participate in a flexible spending account if the employer decides to make that available. So here are some examples of these personal health insurance policy rates and how much less expensive they are because they don't have those federal and state mandates, and we're actually looking at the age of the participant to determine the rate. A single 35-year-old could get a plan for $216 which is about half the national average, and a high deductible plan for only $165. A family of 4 could get a traditional plan, again, for about half the cost of an employer-sponsored plan, $591, even with the same carrier, and a high deductible plan for just $379. So these individual premiums reflect what can be done on this individual health insurance market versus the employer-sponsored market. All right, so the next thing we want to talk about is plan design and why an HSA might be the best way to go. We're typically over-insuring the healthy. 30% of the members of health insurance plans actually use $0. They don't go to the doctor. They don't have a prescription filled. They're not participating on an annual basis in making claims. 73% of members actually use $1,000 or less. So what this means is we've got all these people paying thousands of dollars in premium for small claims administration. We're paying out on average $4,000 for singles, $13,000 for a family to just administer small claims for the most part. And the problem is we never know when the big claim is going to come. So the most optimally designed health insurance plan would be one that would allow you to cut your premiums in half, pay for the small things, the things that are $1,000 or $2,000 or less, out of an account that's tax-free. And when you reach a certain point, when the small claims add up to a certain amount, or you have a big claim, the insurance carrier would pick up 100% at that point. So there actually is a plan that exists. It's called a high deductible health plan with a health savings account, and they represent the biggest change in health and retirement care since Social Security and Medicare. They allow you to save hundreds of thousands of dollars tax-free for future medical expenses or retirement. And the way that these plans work, there are 2 components. You've got the high deductible plan. It covers 100% of your traditional expenses subject to the deductible, and that's coupled with a tax-sheltered account to cover out-of-pocket medical expenses tax-free until that deductible is met, also known as a super IRA. The way these things work, you're actually issued a debit card that's going to be connected to the health savings account. You can use that card to pay for the medical expenses as they occur throughout the year. You no longer pay for a doctor visit or a hospital stay at the time of service. You do receive the PPO discounts associated with the provider that you choose that they've already established. So once the discounts are applied, you're sent an explanation of benefits from the insurance carrier, shows what they were billed, what they reduced the premium or the costs to based on their PPO network. And then a couple weeks after that, you'll actually receive a bill from the provider that reflects those reduced fees. And you can pay for that with your Visa card or your debit card, or you can contact the provider and negotiate a payment schedule if you don't have enough money in your health savings account. So what we're trying to accomplish here is to help out the typical American family. Because the premiums have gotten so out of line, they're not able to afford adequate life insurance. Nobody's been able to save for retirement. And our health insurance plans actually don't provide as much financial stability as they used to, because every year when we get our premium increases, our co-pays, our deductibles, our responsibilities going up at the same time, and we don't have enough financial stability even with the health insurance plans we have. So for the same amount of money, what we're wanting to accomplish is to bring the health insurance premiums in line. We can cut those premiums in half. You can afford adequate life insurance, critical illness insurance, accident coverage, disability, and put money away for retirement if you're using a health savings account, all for the same amount of dollars that were being spent previously just to pay for the health insurance. The leading causes of medical expenses by a Harvard Law School study are actually heart disease, stroke, cancer, and accident. So that means 87% of all major claims involve heart disease, cancer, stroke, or an accident. You can actually buy supplemental coverage that can pay the deductible for you on one of these high deductible health plans for all of these major claims. What's the process? As the employer, we'll need you to complete the initial interview form and census that's available on this site. You'll then fax or email them to the contact info provided on this page, and you'll be contacted shortly by one of our benefit specialists We'll tailor the plan and optimize it for your company and show you some of the tax savings and other benefits you'll be able to appreciate on top of providing your employees with better coverage for less money. The process for the employees will be to speak with a consultant to help them choose which plan is best for them. They'll have a representation of multiple carriers that are available in your state. They'll provide that consultant with medical and banking information. The premiums must be paid for out of their own checking account for it to qualify as a personal health insurance plan. And then they'll follow up with underwriters if they need more information. And then that tax-free reimbursement will be available direct deposit on payday.